Pictures speak 1,000 words, they say, but some pictures tell whole stories. You can look at a picture and tell a whole story about a situation. The next person that I'm going to talk about here is Jeff Rohde, who is here. Now, Jeff used to work for the Star-Ledger before taking a quiet little job as a multimedia specialist, and I say that quietly because he really became the person that was the point person at Holy Name Medical Center in my hometown of Teaneck, New Jersey. Then COVID-19 hit. Teaneck was one of the first ground zeros in the nation. So much so, my own producers told me I can't cover stories in my own hometown. That's how bad the situation was. And because of the nature of the pandemic, cameramen and photographers often could not get in to document what was happening, particularly in our hospitals, especially at first. But Jeff was already inside, and he was an experienced journalist. His photos were picked up by newscasts throughout the nation. So, Jeff, where are you?
Jeff Rohde.
Jeff Rohde, come on up, man. Congratulations, Jeff. Great job. Thank you very much.
Thank you. Good evening. 18 months ago, I started to document what became the first and hopefully the last crisis of this size we will ever see. Holy Name Medical Center had their first COVID positive patients in early March. We became the epicenter of New Jersey, and we soon maintained 250 positive patients for over 2 months. I had the unique opportunity to embed with the frontline workers inside the hospital and share a perspective of patients, caregivers, construction teams, and even the staff in the morgue. As a photojournalist inside a hospital, I knew I couldn't change history, but I wanted to record it. The days and the weeks were long, and the adrenaline seemed endless. We were all scared that we would get sick, and we were scared that we would get the people at home that we loved sick. There were times while documenting that I would put my cameras down and hold the hands of a patient for comfort, FaceTime with their family, or just talk and give them advice as a stand-in family member. There was a sense of unity that developed between the staff and the patients, and it was a sense that we were all in this together, and we all had the shared goal of surviving it. I'm really honored to receive this award, but I would like to accept it on behalf of all the courageous frontline workers because we were all there together. It was something I hope I never have to experience, but was glad I was there. Thank you.
Jeff, tell us a little bit about the award that you got and how you got this story.
The award that I got today was for Courage Under Fire for coverage of COVID-19 in 2020. And I had worked for a hospital for 9 years prior to COVID-19. And that gave me the advantage of knowing people inside, knowing how to operate safely, knowing how to put on PPE, keep myself safe and the staff safe and patients safe. And as a result of that, I was allowed to move about just as I would on a normal day, even though COVID-19 was in the hospital.
Any, aside from the challenges of all the PPEs and social distancing and all of the protocols you had to take part in, any other challenges that you faced in getting the story?
Well, the hospital automatically became my beat, just like any other reporter would do. And every day when I came in the morning, I would go from floor to floor. I would pass out my cell phone number, talk to people, see what they thought was going to be happening that day, if there was anything that I was unaware of. And throughout the day, I'd get calls, and I'd run all over covering. So it was exhausting, especially when you consider we were double masked the whole time. The other biggest challenge was emotional, because we had coworkers who were dying. We had coworkers' families that were dying. We had nurses' husbands that were dying. And we were still working through it, as well as taking care of everybody else. So that was a real challenge.
As the numbers are starting to drift upward again, how do you, what's your feeling about where we are and what people should be doing?
As numbers climb, I'm being more cautious in more situations, and
I've never abandoned my mask, but I'll take it off when I'm comfortable, and if I feel the need and I'm becoming uncomfortable, I'll put it back on. And I've noticed that I'm putting it on more often, but I hope more people do also.
As you went through the process and reported the story, any surprises that you came across that you weren't expecting?
I didn't expect to have the connection with patients and especially and their families, especially when the patient may not have been able to communicate. An intubated patient is unconscious and on a ventilator, yet I was FaceTiming with their families and I was crying with their families, and we were sharing the same emotions at the same time. And in one instance, there was a patient that came off a ventilator, and he's doing well now, and we became friends, and we had quite a bond after that.
Tough story to report, and it's something that will stay with you. Congratulations. Thanks for doing it.
Thank you very much.